What neuroscience builds resilience for bone cancer patients? Imagine your brain as a powerful control center that helps you handle life's toughest challenges. When facing bone cancer, your brain works hard to manage pain, stress, and emotional ups and downs. Neuroscience research shows that building resilience involves strengthening specific brain functions that help you stay strong and adaptable. The key areas involved are the prefrontal cortex, which helps with decision-making and emotional regulation, and the thalamus, which plays a role in processing pain signals. When these areas work well together, they help you cope better with pain and emotional stress. In bone cancer patients, sometimes these brain areas don't function as effectively, which can make pain feel worse and emotional stress harder to manage. This can weaken resilience, making it harder to stay positive and focused. But the good news is that certain psychological approaches can help strengthen these brain pathways. For example, therapies that focus on changing thought patterns and developing coping skills can boost activity in the prefrontal cortex. This, in turn, improves your ability to control pain and emotional reactions, helping you feel more in charge of your experience. Psychological resilience is about being able to bounce back and adapt, even when faced with difficult circumstances like a serious illness. Neuroscience shows that resilience is linked to brain circuits involved in being flexible with thoughts and emotions and responding to stress effectively. For bone cancer patients, ongoing pain and the emotional weight of diagnosis can challenge these circuits. But engaging in practices like cognitive behavioral therapy, which is based on neuroscience principles, can help. This therapy encourages healthier thinking patterns, promotes emotional regulation, and builds a sense of control. As a result, patients often experience less anxiety and depression, better adherence to treatment, and an improved quality of life. Building resilience also acts as a shield against the mental toll of cancer. Patients with higher resilience tend to report feeling less anxious, less depressed, and more capable of handling fatigue and social challenges. Brain studies suggest that resilient individuals show more effective connectivity and activity in regions responsible for managing stress and pain. This means their brains are better at turning down the volume on distress signals, helping them stay calmer and more focused. Practical ways to foster resilience include engaging in therapies like cognitive behavioral therapy, which can strengthen the brain's ability to regulate emotions and pain. Encouraging patients to adopt healthy coping strategies, such as mindfulness, relaxation techniques, and social support, can also make a big difference. Addressing pain through a multidisciplinary approach that considers both physical and mental health helps reinforce resilience. Remember, resilience is influenced by personal, social, and environmental factors, so tailored support is essential. In summary, neuroscience highlights that resilience in bone cancer patients is built by enhancing brain functions involved in managing pain and emotions. Strengthening these neural pathways through psychological therapies like cognitive behavioral therapy can improve mental health and treatment outcomes. It's important to work with healthcare professionals to develop personalized strategies that support both your physical and emotional well-being. Building resilience is a journey that involves understanding your brain's incredible capacity to adapt and grow stronger, even in the face of serious illness.